Doctors are advising parents to get their children vaccinated against COVID-19, even if they've caught the illness before. They say natural immunity from past infections shouldn't be relied upon. The advice comes after KK Women's and Children's Hospital conducted a study of 150,000 children, and it found that vaccination gave added protection against the Omicron variant for those who were previously infected. Among 5 to 11-year-olds who were infected before, those vaccinated were 74% less likely to get reinfected by the Omicron BA4 and BA5 variants compared to the unvaccinated children. Now, the odds increased past 85% for 12 to 17-year-olds. When it came to the Omicron XBB variant, those aged 5 to 11 had a more than 60% protection rate. It was around 58% for children aged 12 to 17. While the majority of the population were infected at least once, the study's lead doctor is urging parents not to be complacent. He's urging parents to get their children protected as much as possible.
There's a general tendency to feel that once my child has been infected, that I think they will have natural protection against any kind of COVID in the future. I think what we found is that, yes, there's an element of protection from having had the infection, but what we found is that getting the vaccine actually provided additional protection even after you've been infected against the new variants that we've seen emerging within our population.
Children who were vaccinated before infection had the highest levels of protection. 5 to 11-year-olds had more than 85% protection, and 12 to 17-year-olds, well, they had nearly 83% protection. Now, these are against the Omicron BA4 and BA5 variants. The KKH team says that vaccination remains the best protection to minimize the risks. They say it's difficult to know if a child might get a severe or mild infection.
Children can be quite unwell with upper respiratory symptoms. Unfortunately, some children will need hospitalization. Some of them, unfortunately, do have a condition called long COVID, where symptoms persist for a long period before they resolve or takes a long time to get better.
Children between the ages of 5 and 17 are recommended to have 3 doses. They can get the Pfizer vaccine at any joint testing and vaccination centre and selected polyclinics. The Novavax jab is available at participating GP clinics.